Hi, my name is Dr. Peter DeWitt. I'm an integrative medicine specialist practicing in Tyler, Texas. I have a fascinating recall healing case to discuss with you. Recall healing is one of the tools that I use in my office every single day with every single patient. And it's an extraordinary medical science that has been developing over the last 27 years and coming into its own over the last 3 or 4 years as more and more is being understood about how things work and why we get sick. So it really gets to the root of illness. It's a phenomenal understanding of why we get sick. You know, we have this tremendous mystery as to what illness is, and you know, even the question of whether it has a purpose or not comes up, but is very seldom answered. So the bottom line is that disease has a purpose. There's nothing random in this universe, seemingly. So I'm going to tell you about a case of Hashimoto's thyroiditis, which is the most common thyroid disease, or at least cause of the most common thyroid disease, which is hypothyroidism. So that's where the body makes antibodies against the thyroid, and the thyroid just gradually loses the ability to make thyroid hormone, resulting in all the classical symptoms we see related to hypothyroidism, like hair falling out, just feeling tired, you know, a low body temperature, metabolic problems, dry skin, you name it, even constipation and depression. So Hashimoto's is a very fascinating case that I had about a year ago. And in this particular instance, when we took a history on this patient, we found out that she was about 55 years old when she developed this particular illness. And as it turns out, and this was about 2 years before she saw me, and it was very sudden, according to her. You know, just one day she was feeling fine, and almost like the next day, she was just down and out, severe chronic fatigue, you know, just feeling bad, hair falling out, hair thinning, eyebrows thinning, and so forth. So in taking a history, we discovered that she had a conflict that developed at a very specific instance in time, and that was when her mother died. Her mother, and actually the conflict started about 6 months before that, because her mother was diagnosed with cancer, with an incurable cancer, and she was told by her physicians that she was only going to be living for maybe 6 more months. It's one of the crimes that we see so much of in medicine, where physicians speak death to patients and you know, actually give out death sentences, thinking that they, you know, owe the patient that, you know, but not only did it affect the person with the cancer, I believe, but it also had a devastating effect on the daughter, because the moment the daughter heard that, it threatened to overwhelm her cerebrum, or the main part of the brain that we think with, that we, you know, can actually discern with. And so what her brain did is it instantly downloaded to a smaller part of itself, and at the same time to an organ. And it's always congruent with a specific conflict as to which organ is involved. In this particular situation, it was a conflict of time, a time-based conflict. Now, how does that work? Well, in this particular case, the daughter knew that her mother had 6 months to live. She loved her mother, and so she literally subconsciously tried to slow down time. She wanted to slow down time so that, you know, she could spend as much time with her mother as possible. So guess what? You know, if you take 6 months and it feels like 6 years, then, you know, you get the illusion that you're spending more time, maybe. In any case, it's of course the brain's protection against this overwhelm, against this trauma. So the brain goes to launching this program that affects the thyroid. And so in her particular case, actually I mentioned just now that Symptoms started as soon as the mother died. Actually started as soon as the mother was diagnosed. That's when the thyroid basically was downgraded, the function was downgraded, and she developed all the classical symptoms. It took 6 months before it was diagnosed. So it was only diagnosed after her mother actually died. And then she went to the doctor, and they found that she had no thyroid hormone hardly at all, severe hypothyroidism, and they also found very high antibodies in her bloodstream against the thyroid. Now then later on, 2 years later, she went to a physician that knew about recall healing, and that physician basically discovered this program. He walked us back, found out from her what was going on at the time of her life, also found out some more about her childhood, as childhood experiences with her mother, and found out a little bit about the genealogy, even a little bit about what happened in the womb when she was conceived, in the uterus, and at her birth. And all of this together helped this patient to clear this program, and the hypothyroidism disappeared. As a matter of fact, they had to rapidly reduce her thyroid hormone, or we had to rapidly reduce her thyroid hormone to the point where she came off it completely and reestablished a totally normal thyroid. This is not supposed to happen in medicine. These are chronic diseases. Physicians tell patients, they're going to have to deal with this for the rest of their lives. But here's a case where, there's spontaneous remission of that disease, and it's very, very clear that this particular modality, recall healing, is a phenomenal modality to help track down and resolve these conflicts.